Hello, and welcome to the presentation on Long COVID 101 brought to you by the Good Clinic. The key things you'll learn from this presentation are what the definition of long COVID is, the causes of long COVID, how long COVID is diagnosed and treated, and then resources for long COVID learning and care. My name is Dr. Kim Young. I am the Director of Clinical Education, Training, and Development at the Good Clinic. I am also a family nurse practitioner at the Good Clinic. My practice location is at the Nordhaus Clinic in Northeast Minneapolis. So what is long COVID? You might have heard of long COVID, or you might have heard of long haulers. Those are two in the same. Long haulers is another term that is used for long COVID. The actual term long COVID, though, is defined by the World Health Organization in the Health Systems and Policy Analysis in Policy Brief number 39 as the following. So it is a condition which is present for 4 or more weeks after the initial acute COVID infection. And in medicine, we say acute means the first onset of that initial disease process. These symptoms of long COVID are quite a very wide variety. So it can include generalized pain, fatigue, shortness of breath, chest pain, muscle aches, palpitations, persisting high temperatures, and cognitive dysfunction. Those are the main symptoms. There are some new symptoms bubbling up as well, but these are the main ones. It can be difficult to distinguish these symptoms from those that occur for other reasons, and the exact mechanism by which long COVID develops remains unknown. There's no specific correlation with the acute phase severity, and I'll get to that in the next coming slides. The one thing we are seeing a common theme of is one keyword: inflammation. So we know that COVID triggers an inflammatory response in the body, and that is the response that kind of stays on in certain organs and systems in the body after COVID, creating long COVID. So these numbers were pulled in May of 2022 from the Centers for Disease Control, CDC, and these numbers are rising. So back in May of 2022, long COVID had impacted 9.4 million Americans and counting. 10 to 20% of people with COVID-19 have lingering symptoms. And there are hundreds of groups working together to find answers for long COVID. We'll mention a few in this presentation. A great resource is the CDC, and there's a Long COVID Alliance that we'll also mention. The Long COVID Alliance brings in a lot of other groups that are doing research, case-by-case studies, trying to get to a better definition of what this disease is and how we can truly help treat each and every form of this disease. A China study on long COVID mentioned by Dr. Nancy Klimas in the Long COVID Alliance studies showed that out of 1,733 hospitalized patients, 3/4 of them had at least one ongoing symptom after 6 months of initial COVID-19 infection. The main symptoms noted were fatigue and weakness, 63%. So over 50% of these people are noting that they are markedly tired and or weak. They have dyspnea, 26%. That's also called shortness of breath. They reported sleeping difficulties, 26%. 22% of them reported hair loss, and that could be from a specific area and or generalized hair loss throughout the whole body. Smell disorder, 11%. Palpitations, 9%, and palpitations could mean like an irregular heartbeat, a rapid heartbeat, a skipped beat. That falls in the realm of what palpitations could be noted by patients. And joint pain, and this isn't just one single joint, it's random major musculoskeletal joint pain. And it could be that a person had pain maybe in their knee, or they had pain in their hands. It could be any joint, but random joint pain after the infection, 9% reported that. And here's an interesting thing. 1 in 5 patients that did not need supplemental oxygen during the initial infection. So in other words, they came in, they had COVID, but they did not need to be put on oxygen for any reason. They still, some of them, 1 in 5, had a decreased lung function noted 6 months after the initial infection of COVID. So there's some other long COVID study findings mentioned by the CDC and World Health Organization, and a few of those studies have found some significant results, and one is prolonged symptoms and new symptoms are being seen even among those that had mild COVID that did not go to the hospital. So somebody had COVID, they didn't go to the hospital, they recovered at home. Even some of those folks are coming up with prolonged and new symptoms and long COVID. Also noted in these studies was that genetic females are more likely to have long COVID than genetic males because it's an inflammatory process, and genetic females are at higher risk for inflammation. Seniors are also at higher risk for long COVID simply because they don't have the capacity for inflammation that a younger body might have. Depression. So depression was a noted finding in a majority of the studies. They feel so far that this is likely related to the extreme fatigue and brain fog that was also commonly found via patient self-reporting tools. And lastly, it's a reminder that scientific knowledge about long COVID is still growing. So we're really going to be learning a lot more as every year goes by to what long COVID is and what the long-term ramifications of this disease process is. So here's the big question: what causes long COVID? Well, so far, what we've deducted is that it's pro-inflammatory cytokines. These are a substance, the cytokine is a substance that's secreted by certain cells of the immune system, and they're produced in the initial phase of the COVID infection. So these cytokines, think of them as setting little fires of inflammation off throughout the body. They are designed to kill the virus. So the body puts these cytokines out on purpose to kill the virus. However, here's the catch: they're unintentionally harmful because there is not a good counterbalance with the anti-inflammatory cytokines. So you have this over amount of these pro-inflammatory cytokines. So think of these little Pac-Man going around and making a lot of fires, and then not enough other Pac-Man going around able to kind of neutralize the fire once the fire is taken care of and the virus is destroyed. So this imbalance of pro-inflammatory to anti-inflammatory cytokines is causing these long-term symptoms, and that is inflammation and oxidative stress in the body. So simply put, key components of long COVID are inflammation and oxidative stress in the body, and unfortunately they drive each other. So once you have inflammation in the body, it creates oxidative stress. In the body having oxidative stress, that creates more inflammation. So it's this vicious cycle that goes on in the body as a part of this process. And there are certain key targets of long COVID in the body. And again, we're learning more, but the key targets so far that we've seen are lungs, brain, heart, GI tract, adrenal glands, liver, and kidneys. There also was some talk on previous slides of joint pain. And certainly when you have the brain affected, that brings in all of the different mental health issues, including a large majority of patients with long COVID reporting that depression. So we talked about the cause of long COVID. Now let's talk about how is it diagnosed? Well, this is tricky. There's no simple symptom or test for the diagnosing of long COVID. Symptoms can overlap with many other conditions because we're talking about an inflammatory process, and there's a number of inflammatory conditions that exist. So this is what we call a clinical diagnosis. It's based on a history of having COVID-19 and failure to fully recover. A positive swab or antibody test, it can be helpful, but it's not a prerequisite for the diagnosis. So why isn't testing a requirement? Well, number one, there are no COVID tests that are 100% sensitive, and in science, there really aren't any 100% sensitive tests. So that's why it's not required. And the other thing is PCR antibody testing could miss patients with residual symptoms from older infections. So antibodies decline substantially by about 4 months. So if for example, a client had COVID maybe back in February of 2020, and then you fast forward to October or November of 2020, and you want to run an antibody test on them to see if they've ever, quote unquote, had COVID. Well, it might not come up positive, showing that they've had COVID, because the antibodies decline substantially, so much so. So this is why testing isn't a requirement. So in order to help those of us that are out there diagnosing long COVID, there are a bit of guidelines that are established, and some clear guidelines put out by NICE, which is the National Institute for Health and Clinical Excellence, are the following. If you have a client that has ongoing symptomatic COVID-19, in other words, the symptoms are present 4 to 12 weeks after the start of an initial COVID-19 infection that are not explained by any alternative diagnosis, then there's a pretty good chance you can hang your hat on the fact that the patient's suffering from long COVID. Also, there's post-COVID-19 syndrome, and that is when symptoms have not resolved 12 weeks after the start of the initial phase of the acute COVID-19 infection. So clinical diagnoses are a little bit controversial in the fact that a lot of us want a test that says this is exactly what I have. And a clinical diagnosis is more of a deductive reasoning of critical thinking based on what is the medical history, and then what are the other things going on with that particular client. So they get a little sticky, but long COVID at this point is more of a clinical diagnosis than tests. Now, it doesn't mean we don't rely on tests. I want to go back and just say, yes, you can do a test. It doesn't hurt to do a test. But the lack of antibodies doesn't mean that a person does not have long COVID. And that's simply because the antibodies decrease so rapidly after 4 months of having the initial COVID. The one thing that is needed for this diagnosis is an initial diagnosis of acute phase COVID. So the client has to have had that acute onset, I don't feel good, I've got COVID-19. That is the one prerequisite. So what are the current treatments for long COVID? Well, this does vary, and this depends upon what body system is being affected. Most important step is if a client, a loved one, yourself, if you're like, I have had COVID-19 and I still have these ongoing symptoms, it's been 4, 6, 10 weeks down the road, and I just can't shake this shortness of breath, or I just can't shake this fatigue and brain fog. The most important step is to have a consult with your provider, a provider who's educated on what long COVID is, and one that keeps up with the latest evidence regarding the diagnosis and treatment of long COVID. Once the client is diagnosed, the following may happen. Most of the time, there's going to be some sort of supportive care prescribed, and that is for the system that's affected. So it might include supplementation. And for an example, it might include some supplements that really help boost the immune system and or reduce inflammation. So you might see some vitamin D supplementation. You might see some herbal supplementations that are really working on supporting decreased inflammation to the point where maybe the person can't get this from a regular diet, so they'll be supplementing. There might be exercise rehabilitation and physical therapy that goes in to effect, and this is, for example, maybe somebody that has significant shortness of breath that they're dealing with, and they really need to have some help on expanding their lung function and their ability to endure physical exertion. It could be physical therapy for, joint pain, joints that are affected from long COVID. Further specific system testing also can be done, certainly on an as-needed basis for ongoing symptoms. So that's why that visit is so key, because then the provider will sit down, really dig into the symptoms and say, let's see about if there's any other tests, if there's any other things going on, and what kind of supportive care we can do. And then also referring out to specialists as needed. So examples include infectious disease specialists, cardiologists, pulmonologists, gastroenterologists, and immunology. An example of this might be a patient that comes in saying, hey, I had COVID and I'm having these palpitations and this shortness of breath, and I'm not sure what to do. remember to congratulate them that they took the right step and say, good job, you got yourself in here, and we're going to take care of you, and we're going to investigate this. Now I'm going to speak to the providers. It's up to us to really listen to that client and really do our good investigation. So if we have someone coming in saying, I've got shortness of breath, I'm having palpitations, something isn't right, we owe them our due diligence to do the workup. For example, we might need to get an echocardiogram and EKG on that patient. And then let's say the echocardiogram might show some cardiomegaly or some sort of valve issue. That's when we're going to refer them over to cardiology. It's just an example, but that walks you through that the trigger in all of this is to have that initial consult if the client is still having some ongoing COVID symptoms. Then after that, the provider can work with them and get them the right testing, the right supportive care, and if needed, refer them to the right specialists. So resources for long COVID learning and care, there are quite a few out there. We've put some good ones here on this slide. So certainly the CDC has a wealth of information, and they have a wealth of information for clients/patients and also for providers. That's where a lot of this information from this presentation was retrieved from, along with the Minnesota Department of Health. We are located, the Good Clinic is located in the state of Minnesota, so at this point in time, we also are looking to the Minnesota Department of Health for some information about COVID-19, long COVID, and the local infection rates and symptoms around that, local cases. The Long COVID Alliance is a collection of various clinics, providers, clients, and we are part of the Long COVID Alliance here at the Good Clinic, and the Long COVID Alliance is literally a partnership of people that are depositing information and supporting the growth of knowledge related to long COVID. Then also for long COVID support or long hauler support, if that's what you know it as, longcovid.org is a place that you can go to get some good support resources. Again, there are other resources out there, but here's some pretty good ones to start with. Please come see us at the Good Clinic if you are concerned in any way that, hey, I've had this COVID-19 infection and I'm 4, 6, 10 weeks out and I'm still not feeling right. I'm still having some symptoms that are bothering me. Our providers are very well educated. They'll be watching the same presentation. They'll be digging into these same resources, and we're here to help you if you have COVID concerns and or long COVID or long hauler concerns. We can also refer out to specialty services as needed. So we're happy to see you here at the Good Clinic for any concerns about long COVID.